Hello, everyone. I am Claude Bernard, a doctoral candidate in Health Informatics and a cybersecurity advocate, bridging health, technology, and human stories. And I want to welcome you to episode 17 of the CyberClinic Podcast. When most people hear the term ADHD, they picture a hyperactive child bouncing in their chair or blurting out answers in class. But that's only part of the story, and an outdated one at that. ADHD or attention deficit hyperactivity disorder is not just a childhood condition. It's a lifelong neurodevelopmental profile that can shape how you think, feel, and function in ways that are both challenging and surprisingly powerful. In adults, ADHD often hides in plain sight, masked by intelligence, charm, or sheer grit. But behind the polished surface, there's usually a cycle of overwhelm, procrastination, burnout, and self criticism. As you already know, you're smart, you're capable, you're passionate. So, why do the small things, emails, bills, deadlines, slip through your fingers like water? Why do you feel like you're running a marathon every day, but somehow still end up behind? If this feels uncomfortably familiar, you're not alone. Millions of adults live with ADHD, many without even knowing it. And today, we're going to strip away the myths, look at the science, and talk about what works. So, in this episode, we're going to explore what ADHD really is, why it's so often missed in adults, especially women and people of color, and how cutting edge research, clinical insight, and even AI are changing the game. Whether you're a healthcare professional, a policymaker, or someone wondering, could this be me? This conversation will give you clarity, tools, and hope. So, before we dive deeper into myths, research, and what ADHD looks like in adults, let's ground ourselves in the basics. Because to really understand the challenges and the strengths, we first need to answer a simple but crucial question. What exactly is ADHD? Let's break it down. Attention deficit hyperactivity disorder is a neurodevelopmental condition characterized by persistent patterns of inattention, hyperactivity, and or impulsivity that interfere with daily functioning across multiple settings, such as work, home, relationships, and education. In adults, ADHD might look less like running laps around the classroom and more like mental restlessness, chronic disorganization, difficulty starting tasks, emotional overreaction, or trouble sustaining focus, especially on tasks that feel boring, repetitive, or low stakes. The consensus in neuroscience is clear. ADHD stems from differences in brain structure and chemistry, especially in areas related to executive function like planning, time management, and impulse control. It is not a moral failing. It's not about laziness. And importantly, it's highly manageable with the right strategies and support. We know ADHD isn't just about childhood hyperactivity. It's a neurodevelopmental difference that continues into adulthood. But there's the tricky part. Adults don't always recognize it in themselves. The symptoms can hide in plain sight, showing up not as constant motion, but as patterns of disorganization, time struggles, and emotional overwhelm. And this isn't just opinion. Both research and clinical practice point to the same reality. As a doctoral candidate in health informatics and a cybersecurity advocate, I've spent a lot of time studying how conditions like ADHD show up differently across the lifespan. What clinicians consistently report is that many adults only begin to recognize ADHD when they face lifelong patterns of difficulty, not just isolated moments. That brings us to an important question. How do people know they might be living with ADHD as adults? Adults often wonder if their lifelong struggles are ADHD. Unlike children, adults don't always show overt hyperactivity. Instead, patterns show up in daily functioning such as time management issues, chronic lateness, time blindness, procrastination, and difficulty meeting deadlines. Workplace struggles, needing extra reminders, incomplete projects, and difficulty with sustained attention on tedious tasks. Executive function challenges, trouble organizing, planning, and prioritizing. Relationship impacts, impulsive comments, forgetting commitments, feeling scatterbrained. Compensatory masking. Adults may over prepare, overschedule, or push themselves harder to hide difficulties leading to exhaustion. Screening tools like the ASRS version 1.1 Adult ADHD Self-Report Scale are often used as a first step, but formal diagnosis requires a structured clinical interview across developmental history. Now that we know how ADHD can appear in adulthood, there's another layer worth talking about: something that often keeps the condition hidden even longer. It's called masking, and many adults use it without even realizing it. Here's something you might not expect. Many adults with ADHD mask their symptoms. They camouflage, they overprepare, overschedule, rehearse conversations, or arrive extra early to cover the cracks. Research shows that while this kind of camouflaging happens less than in autism, it's still more common than in neurotypical adults. And it comes at a cost. Masking is exhausting, it delays diagnosis, and it often makes ADHD invisible to high achieving adults. That's why clinicians stress the importance of looking at compensatory strategies, not just overt symptoms, when evaluating for ADHD. Why does that matter? Masking can delay diagnosis, contribute to exhaustion, and make ADHD invisible in high achieving adults. So, a careful history should include compensatory strategies, not just overt symptoms. If ADHD isn't about willpower or discipline, then where does it come from? One of the most common questions people ask is ADHD inherited? Let's look at what science tells us. The answer is yes, essentially. Family, twin, and adoption studies consistently show high heritability, about 70 to 80%. That means most of the variation in ADHD traits is explained by genetics, though not single gene determines the outcome. Genome-wide studies show ADHD is polygenic, influenced by many minor genetic variants. Adoption and sibling studies confirm ADHD tends to run in families for biological reasons, not because of parenting style. Of course, genetics isn't the whole story. ADHD doesn't exist in isolation. It is shaped by brain biology and influenced by environment. So how do all these pieces fit together? Let's see how genetics, neurobiology, and environment fit together. Think of ADHD as predisposition plus influences. Genetics, highly heritable and polygenic. ADHD runs in families. Neurobiology. Imaging shows slight but consistent differences in frontostriatal networks, dopamine, and norepinephrine signaling and delayed cortical maturation. Environment. Prenatal tobacco exposure, lead, prematurity, and early adversity modestly raise risk. Bottom line, ADHD is primarily genetic, shaped by neurobiology, and influenced by, but not caused by, environment. It's not about willpower. It's not about parenting. And this brings us to one of the most persistent myths that ADHD is caused by bad parenting. Let's be clear right from the start, this is not true. Authoritative guidelines and public health agencies emphasize this point. Parenting can shape coping strategies, comorbid behaviors, and family stress, but it is not the origin of ADHD. Parent training programs exist to help families navigate ADHD, not because parenting created it. Here's an interesting point about families. Adoption and sibling studies indicate familial clustering of ADHD is primarily genetic rather than due to shared parenting practices. We've talked about where ADHD comes from. What about the future? Can ADHD be cured? Here's what clinicians say. Clinicians stress that ADHD is not curable. In the traditional sense, it's a chronic neurodevelopmental condition. However, symptoms can be well managed with treatment, and many adults learn strategies to thrive. Think of it like diabetes or asthma. Manageable, but not erased. Now that we've covered the science, let's bring it back to earth. What does ADHD look like in daily life? Core features, including attention, disorganization, forgetfulness, and hyperactivity impulsivity characterized by restlessness or interruption. Adult daily patterns include time blindness and deadline crunching, executive function overload, planning shifting tasks, working memory, attention swings, hyperfocus on passions, difficulty with tedious tasks, emotional dysregulation, and sleep irregularities. And here's something crucial. ADHD usually doesn't just disappear. Longitudinal studies show most children continue to meet criteria as adults, though symptoms may wax and wane. And this is where numbers help tell the story. How common is ADHD really in the United States and around the world? Here are some ADHD statistics in the United States. Children ages 3 through 17, about 11.4% have ever been diagnosed with ADHD based on 22 parent reported data. Diagnosis rates vary by state, ranging from 6% to 16%, with treatment rates also showing wide variation. Medication usage. 38 to 81%, behavior therapy, 39 to 62%. This has been reported by the CDC. Adults, a recent estimate indicates about 15 million US adults, approximately 1 in 17 people, have been diagnosed with ADHD. This suggests a diagnosed adult ADHD prevalence of roughly 6%, which aligns with other studies in community settings. Now, let's talk about the persistence across the lifespan. Most children with ADHD do not simply grow out of it. Longitudinal work shows symptom persistence into adulthood is common. Trajectories often fluctuate rather than showing permanent remission. In the landmark MTA cohort, only approximately 9% achieved sustained recovery by young adulthood. Most showed alternating remission and recurrence, with residual symptoms common. Other studies estimate that approximately 60% of individuals show persistent symptoms into emerging adulthood when modern adult criteria are applied. The key takeaway here is this. ADHD is one of the most common neurodevelopmental diagnoses in children in the US, roughly 1 in 9. And adult diagnoses are also substantial and rising. Of course, the picture changes depending on where you live. Let's take a closer look at ADHD prevalence across different countries and cultures. When we talk about ADHD, it's easy to assume the numbers look the same everywhere, but that's not the case. Prevalence varies a lot depending on where you live, though the reasons are often more about diagnosis and culture than biology. Let's take a tour around the world. Let's start with Africa. In Ethiopia, research in JIMA shows that nearly 1 in 10 children, about 9.9%, are living with ADHD. In South Africa, the numbers are even higher in some studies, reaching 12% among children and adolescents. Adult data is still limited across the continent, but these findings show ADHD is far from rare in African populations. Now, shifting to the United States, ADHD is among the most recognized neurodevelopmental conditions. Roughly 11% of children have been diagnosed, and about 6% of adults, or 15 million people, are living with ADHD today. That makes the US one of the highest reporting countries worldwide, primarily driven by strong screening and awareness. Over in Europe, we see much more variation. In Sweden, child prevalence is among the lowest at only 3%, while in the United Kingdom, the numbers rise closer to the global average, around 5 to 7% in children and about 3 to 4% in adults. These differences reflect differences in healthcare systems and diagnostic thresholds rather than true biological disparities. Turning to Asia, the numbers again sit in the middle range. In India, about 7% of children meet criteria for ADHD, while in China, pooled estimates hover around 6%, consistent across mainland China, Hong Kong, and Macau, with slightly lower rates in Taiwan. Adult ADHD is present but less frequently studied, with global estimates suggesting around 2 to 3%. And then there's Iran, where some studies have reported ADHD rates as high as 22% in children, far above global averages. Experts believe these striking high numbers reflect differences in study design, diagnostic criteria, and cultural factors rather than actual biology. So, what does all this mean? Despite the wide range, 1% in some countries and over 20% in others, researchers agree that the actual prevalence of ADHD worldwide is consistent, about 5 to 8% of children and around 2 to 3% of adults. The fundamental differences lie not in biology, but in how countries recognize, diagnose, and respond to ADHD. And that's a critical takeaway. ADHD is global. It affects millions of people across every culture. But whether someone gets diagnosed or supported often depends on the society they live in, not whether they have the condition. So, why are there such vast differences between countries? Why does Sweden report some of the lowest rates, only 3% of children with ADHD, while Iran reports some of the highest, 20%? Why is the US at 11%, while Yemen sits closer to 1%? The answer is not that children in some countries are biologically different. Instead, researchers point to 4 main reasons. First, diagnostic practices. The US has broader criteria and higher screening rates, especially in schools. Countries with more structured pediatric systems tend to have more diagnoses. In contrast, in countries with limited resources, children may never be formally evaluated at all. Second, healthcare access. In higher income countries, families are more likely to reach specialists who can identify ADHD. In lower income settings, limited access to child psychiatrists or psychologists means fewer diagnoses, even if the symptoms are there. Third, cultural views. In some societies, a child who is very active or inattentive is seen as spirited or naughty, not as having a medical condition. In others, that same behavior is interpreted through a clinical lens. And fourth, stigma. Where mental health stigma is strong, parents may avoid seeking help or clinicians may hesitate to apply the ADHD label. This keeps numbers artificially low. So, while statistics vary, sometimes dramatically from country to country, what we're really seeing is a difference in diagnosis and awareness, not in biology. ADHD is present across cultures, and the key challenge is helping people recognize it in themselves. For adults, that recognition often starts with patterns of chronic disorganization, time blindness, and mental exhaustion from years of masking. Now that we've gone over differences among countries, one can ask whether there's a racial component associated with ADHD. Yes, research shows that race and ethnicity absolutely shape how ADHD is diagnosed and treated, though not because of biological differences. The disparities are mostly about access, bias, and cultural interpretation. For example, in the US, Black and Latino children are less likely to be diagnosed with ADHD compared to white children, despite showing similar symptom levels. When they are diagnosed, they are also less likely to receive treatment, especially medications. Some studies suggest Asian American children are underdiagnosed as well, likely due to cultural stigma and parental reluctance to seek mental health care. These gaps are linked to systemic barriers, such as fewer resources in schools serving minority populations, implicit bias among clinicians, and cultural differences in how behaviors are interpreted. Researchers are clear. ADHD is highly heritable, neurobiological, and not caused by poor parenting. But the myths persist. Myths that confuse families, delay treatment, and add unnecessary shame. And busting those myths is one of the most critical steps toward better support for both children and adults living with ADHD. Numbers and theories are one thing, but what do clinicians on the front lines say about ADHD? Clinicians, psychiatrists, psychologists, and neurobiologists emphasize a few consistent points. ADHD is real, valid, and neurodevelopmental. It is not caused by poor discipline, laziness, or bad parenting. The American Psychiatric Association APA and CDC classify it as one of the most common mental health diagnoses in children, often continuing into adulthood. Assessment must be comprehensive. Diagnosis typically involves structured interviews, rating scales, and developmental history, not just a checklist of symptoms. Treatment is multimodal. Clinicians often recommend a combination of medication, behavioral therapy, skills coaching, and accommodation at school or work. Clinicians stress that early recognition matters because untreated ADHD can lead to academic underachievement, workplace struggles, relationship stress, and higher risks of anxiety, depression, and substance misuse. Alongside clinical insight, we also need to tackle the myths because misinformation is one of the most significant barriers to proper understanding and treatment. ADHD is caused by bad parenting. That's false. Parenting can influence coping and stress, but does not cause ADHD. It is essentially biological. Another one is that only kids have ADHD. And that's false. Around 60% of children with ADHD continue to show symptoms into adulthood. Number three, ADHD is just being lazy or unfocused. False. ADHD involves measurable differences in brain networks, regulating attention, impulse control, and executive function. Another one is that medication fixes everything. Not entirely. Stimulants help most, but behavioral therapy, coaching, and environmental support are also crucial. ADHD is overdiagnosed in the US. Partly true. The US does diagnose more, but research shows many adults and women remain underdiagnosed because symptoms present differently. Example, inattentiveness without hyperactivity. Now let's zoom out. ADHD absolutely brings challenges, but it also brings strengths that are too often overlooked. The impacts or challenges: academic work, trouble meeting deadlines, organizing tasks, and maintaining focus on non stimulating work. In terms of relationships, forgetfulness, impulsive comments, emotional reactivity, and the health risks, higher rates of sleep disorders, anxiety, and risk taking behaviors. Strengths, often overlooked, creativity and innovation. Many with ADHD excel in fast paced, dynamic, or idea driven environments. Hyperfocus, ability to deeply engage in tasks of interest, producing bursts of productivity. Resilience and energy. Many describe being resourceful, energetic, and able to adapt quickly under pressure. Clinicians and advocates often say ADHD is not just a deficit, it's a different way of processing the world. So, what does all this mean for someone living with ADHD today? What practical steps can make life easier, healthier, or and more manageable? Seek professional evaluation if daily life feels consistently overwhelming. Treatment options, medications, stimulants like methylphenidate, amphetamines, non-stimulants like atomoxetine, cognitive behavioral therapy adapted for ADHD, ADHD coaching for organization and time management, lifestyle strategies, regular sleep, exercise, structured routines, and digital reminders, accommodations in school, individualized education programs, or the 504 plans, and in the workplace, flexible deadlines, task management tools. Interestingly, technology and especially artificial intelligence is starting to play a surprising role in ADHD care. Here's how AI is starting to reshape ADHD care. Digital screening tools, algorithms trained on questionnaires and behavior data help flag possible ADHD cases earlier. Voice and movement analysis. Pilot studies use AI to detect attention lapses through speech patterns or eye tracking. Personalized treatment. Machine learning models are being developed to predict which patients respond best to stimulant compared to non stimulant medications. Cognitive training apps. AI tailors brain training games to improve working memory or attention span. Early days, but AI may make diagnosis more accessible, affordable, and personalized. And beyond AI, there are everyday tools, apps, wearables, and digital platforms that can help people manage symptoms and thrive. Apps, Todoist, Trello, Notion for task management, FocusMate, Forest, Pomodoro timers for sustained work session. Wearables. Smartwatches can provide medication reminders, nudges to refocus, or sleep tracking. Telehealth platforms expand access to evaluation and treatment, especially in underserved areas. Neurofeedback and digital therapeutics. Some FDA cleared digital games, for example, Endeavor RX, aim to improve focus in children with ADHD. Behind the scenes, researchers around the world are digging deeper into the biology, genetics, and the best interventions for ADHD. Let's highlight some of the major players. Global Consortia, Enigma ADHD, an international brain imaging collaboration studying neurobiology. WHO World Mental Health Surveys, providing global prevalence data. National Institutes of Health, NIH, funding genetic and neurobiological ADHD studies. Academic centers, Massachusetts General Hospital, ADHD Research Program, Duke University ADHD Program, Karolinska Institute in Sweden, Genetics and Epidemiology, advocacy and research groups, CHAD, Children and Adults with ADHD, and ADDA, Attention Deficit Disorder Association, bridging science and community education. So, clinicians are clear. ADHD is a lifelong condition that can be managed but not cured. The impacts are real, but so are the strengths, creativity, energy, resilience. And thanks to new technologies and AI, we're moving toward earlier diagnosis, more personalized treatment, and digital tools that can support daily life. Around the world, researchers from NIH to Enigma are piecing together the genetics, the brain science, and the best interventions. And the message is consistent. ADHD isn't a weakness, it's a difference. With the proper support, people with ADHD can not only cope but truly thrive. All of this leads to one central message. ADHD is real, it's manageable, and help is out there. But the first step always starts with reaching out. If you or someone you know struggles with focus, time management, impulsiveness, or chronic disorganization that disrupts school, work, or relationships, don't ignore it. ADHD is common, treatable, and nothing to be ashamed of. The first step is talking to a qualified healthcare professional. Diagnosis opens the door to support strategies, and if needed, treatment that can truly change lives. So, the call to action is simple. Do not self diagnose. Don't wait. And don't assume it's just laziness or poor disciplines. Reach out for help. Now, maybe you're thinking about yourself or someone close to you. What signs should you look for that might suggest ADHD? Key signs that go beyond being forgetful: inattention, chronic disorganization, losing items, trouble sustaining attention on tedious or repetitive tasks, hyperactivity, restlessness, feeling always on the go, difficulty relaxing, fidgeting, impulsivity, blurting out comments, interrupting and making quick decisions without thinking them through, daily pattern clues, constantly late or missing deadlines, big bursts of productivity during hyperfocus, but difficulty sustaining momentum, relationships strained from forgetfulness or emotional reactivity. Important. Only a professional can diagnose ADHD. These are red flags, not proof. And if those signs feel familiar, who should you turn to first? Let's talk about the experts best positioned to help. Psychiatrists can diagnose and prescribe medications, stimulants or non-stimulants. Often, the lead clinician is for moderate to severe ADHD. Clinical psychologists, neuropsychologists can provide detailed diagnostic evaluations and therapy. Primary care physician, often the first point of contact. Many are trained to diagnose and prescribe, then refer if needed. Therapists, ADHD coaches, cannot diagnose or prescribe but can teach coping skills, executive function strategies, and emotional regulation. Multidisciplinary teams. In many clinics, psychiatrists, psychologists, and therapists work together for holistic care. Best starting point: usually a primary care doctor or psychiatrist, depending on access. They can rule out other causes and initiate treatment. As we close today's conversation, let's bring it all together. What ADHD really is, what it is not, and why understanding it matters so much. In closing, as we wrap up today's conversation on ADHD, let's be clear. This is not a condition caused by bad parenting, laziness, racial background, gender, or lack of willpower. ADHD is a neurodevelopmental difference, one that science has shown is highly heritable and rooted in the brain's networks for attention and self-regulation. Yes, it brings real challenges, missed deadlines, strained relationships, emotional exhaustion, but it also brings strengths, creativity, resilience, and the ability to hyperfocus in powerful ways. With the correct diagnosis, the right strategies, and the proper support, people with ADHD don't just cope, they thrive. My closing thought is this: ADHD is not a flaw to fix, but a difference to understand. If you or someone you love sees these patterns, take that step. Talk to a professional. Awareness leads to acceptance, and acceptance opens the door to change. ADHD may not be curable, but it is manageable. And life with ADHD can be not only successful but extraordinary. Thank you